Dr. Morgan, thanks for loaning your time to us, and thanks for what you do for these patients.
Thanks, Brad. Glad to be here.
So what does it take for them to come to your program? Is that the place where the initial assessment happens, or is this where someone with established dementia or Alzheimer's can come for help?
So we do a variety of things in our practice at MCG. I misplaced my keys the other day and I forgot so-and-so's name, and I know him for years. I evaluate folks that are doing okay, all the way to folks who have advanced dementia. So we care for the whole range of folks that are doing quite well in life, all the way to those with advanced dementia.
If you are forgetting names or you're doing some of those things that the worried well do, can you give them a pill or do something to make those names go back in their head and for them to stop having those episodes?
I usually don't give them a pill. I usually reassure them after doing appropriate tests, just to make sure. So your neurologist may, or your primary doctor may blow this off and say it's no big deal. But sometimes it can be significant in that it's an early sign of you're starting to get forgetful. But if it comes back to you why your keys are in the refrigerator by the milk, or it comes back, the Pauline Primrose's name comes back to you later that night when you're laying in the bed, that helps me say that it's much more benign than ominous.
Do you look for plaque, and that tells you yay or nay if they have something? Otherwise, what is the determining factor to know if it's not just something benign?
Yeah, so the main things that we do is rule out other causes of memory trouble. So you look at thyroid function to make sure their thyroid is not low. You make sure that they don't have an infectious disease called syphilis. Syphilis can cause memory troubles too. You want to make sure that they're
Syphilis is still a thing?
I've had 3 patients that test positive for syphilis that probably had neurosyphilis causing dementia.
Wow.
Yeah, it's really rare, but we do it just as a rule out. And the other thing we check is B12 levels. Vitamin B12, if that's low, that can lead to memory troubles as well. We image everybody looking for any signs of things that you may not expect, like a stroke or tumors or other things like that, to make sure there's no major structural lesions. We can also look for signs of shrinking of the brain called atrophy in certain areas like the temporal lobes, things like that. And then in rare cases we do amyloid imaging like we're discussing. We can test someone with amyloid with a PET scan that lights it up in the brain, or you can do a spinal tap that looks for amyloid in the spinal fluid.
And can you get rid of that plaque?
Well, actually there is some data with research that's ongoing right now that antibodies that attack beta amyloid are clearing the plaque in the brains of Alzheimer's patients. The problem is that how much that correlates with cognitive change is in question.
Are we doing anything here at home? Any trials that people can take part in, or at least that we can await the outcome?
Yeah, we have one trial that's up and right now with more coming, but it's mostly focused on folks with what's called mild cognitive impairment. Mild cognitive impairment is viewed as an early Alzheimer's manifestation in patients, where you have memory troubles. I can test for it and see it on the testing that I do with your memory, and you wind up with findings that are consistent with early Alzheimer's, but you can still take care of your daily living tasks.
What's that assessment look like? Is it just remembering words?
Lots of things. So drawing figures like boxes or squares or pentagon and things like that. Remembering lists of words and recalling as many as you can over time. Also connecting things together and planning things out from A to B to C, what's called executive function, attention and concentration, other tests of memory as well.
Do women do better on those things than men?
Well, actually, women more often develop Alzheimer's than men a little bit more.
Really?
Yeah.
Why? Do we know?
We don't know why that's the case. It may be women may live years longer than men, and Alzheimer's is a disease of aging. So folks up to age 85, up to half of patients age 85 have dementia. So it's very common as we age.
But have you noticed whether men or women perform better on those tests?
I haven't. I don't know if there's really data that reflects that men or women do better. Educational status and pre-morbid function is also important as well.
Yeah, Google told me that women remember words better, men remember images better, and so that can sort of affect the outcome of those tests.
That's possible. Certainly men are more visual than women, I would say.
When you help a patient, can you help them extend, I don't want to say normal, can you help them stave off dementia or Alzheimer's if they get in early enough?
We don't have a definite disease-modifying therapy yet. So there was some news that was just released, you may have seen, from a company called Biogen, which was studying a monoclonal antibody which attacks amyloid called aducanumab. That antibody was shown to clear plaques and improve cognition in very, very early Alzheimer's patients by about 25% or so. So there's some data that's a signal there, and the FDA wants them to continue research along those lines. But we don't have something that definitely slows it down. Things that you can do yourself include mental and physical exercise. Those are well correlated with preserving cognition and brain size and things like that, as well as a Mediterranean diet may be helpful.
What's a Mediterranean diet consist of mainly, for those who don't know? We talking lots of oils and chicken?
Yeah.
And olives?
Yeah, olives and olive oil, chickpeas probably, things like that.
Yeah, and better to do, especially the puzzles and the brain games, before you have anything, right?
Yeah, so keeping your mind active has been shown to keep it juicier and larger compared to how it shrinks later with Alzheimer's disease. So even in folks with cognitive issues, if they exercise their mind and exercise their body, their size of their cortex is bigger.
What's the difference between dementia and Alzheimer's? And I ask you this every time you come here, and do you have to have dementia first?
So that's a great question. A lot of patients will come in and say, my doctor told me I have dementia, but thank God I don't have that Alzheimer's.
Right.
Well, they're the same. So if you can think of this, let's put an analogy. Cancer. You have cancer. Cancer is not a good thing to have, right? You have different types of cancer. Alex Trebek has pancreatic cancer. Others have colon cancer, etc. Dementia is an overarching head. Below that is the most common cause, Alzheimer's disease, and that's at least half of cases. But there's also mixed dementia, which has vascular changes in the brain due to high blood pressure, diabetes, smoking. Those are things you can modify yourself as well, controlling those. Or there's frontotemporal dementia. There's alcoholic dementia if you drink too much. There's all kinds of dementias that are underneath that head.
Dr. Morgan, what's the timetable once a diagnosis is made? And if it's not great news, so when a family leaves your office, how much time do they have before things really start to deteriorate? And I know that's probably too general.
But I get your drift. So folks usually live with Alzheimer's once it's diagnosed with 10 to 12 years or so, that kind of time frame. Luckily, it's diagnosed late in life. And folks often die of other things that take us out of this world: cancer, stroke, heart attack, you pick your poison. But it all depends on the person. So some things that are helpful include doing those exercise type things, physical and mental, but also if you start out a sharper knife in the drawer, that's better for you.
Yeah.
So folks who have a lot higher cognitive reserve, they'll do better over a longer period of time than those who weren't the sharpest.
What do you do about the stress part of it or the panic part of it? Because if I was in that chair across the table from you, I would be extremely uneasy going forward, and maybe that anxiety would take over my ability to do some of the treatments that you recommend. Can you help them cope with that?
Yeah, a lot of times anxiety or depression can be a part of any condition that is degenerative, like Alzheimer's or Parkinson's. But treating the anxiety and depression is important. Medication can be helpful, but also it takes a mindset adjustment. I've got Alzheimer's, but it doesn't have me. Same thing with Parkinson's. You fight back against it, and you just try to do your best on a daily basis. And if you worry about 5 years from now, you're just going to shorten your life from worrying.
What sort of recommendations, probably my last question, can you give to families out there? Maybe if they have a primary care physician who sort of just blows it off and says, oh, you'll be fine, but the person who lives with the patient or potential patient knows that something is wrong. How do we get them to you?
So we have what's called a memory assessment center. It's funded by the state of Georgia. It's a line item budget in the budget each year for about $4 million plus that funds 5 different centers around the state. Emory is the quarterback of the program, and we were the first memory assessment center in that program. So we have a social worker that helps us deal with issues that families are going through. We have referral bases that help get them to the area agency on aging, the Alzheimer's Association, and other things like that to help establish things. And we also have a comprehensive clinic that if you contact us at 706-721-2798, we can get you in a reasonable, timely fashion and evaluate your loved one.
Last question. I was told to wrap as quickly as possible, but this is almost a yes or no. Are you more hopeful now that we're making a dent in this thing than you were when you started your practice?
I would say for sure.
Good.
Number one, because resources, mega resources from pharma, NIH, other folks are going into solving this issue. Because if we don't solve slowing down Alzheimer's and Parkinson's, we're going to have a dementia and Parkinson's tsunami as baby boomers age, and we may not be able to afford it as a country taking care of these folks.
Well said. Dr. John Morgan, thanks for the work that you do.
Thank you very much.
We appreciate it.